I'm privileged to be here with four truly extraordinary people. And when I say that, I mean it sincerely. I mean, since leaving Apple 10 years ago, I've had the privilege of working with some extraordinary founders, literally from around the world. And the four people collected here today are literally incredible. What they've achieved, their backstories are phenomenal. One thing that's really interesting about it, that they've all built organizations. I was going to call them a business. Some of them are businesses, some organizations at scale. And they've had major challenges in order to achieve that objective. But to add some sort of context to where I'd like to start the conversation, I want to start with sort of two bits of comment in terms of perspectives of where I see things today. Is that certainly in healthcare, I think we're dealing with the challenges of yesterday, looked at with the eye of tomorrow. I don't want to talk about COVID, but I do want to look at the consequences of COVID. And each of these businesses were not designed for COVID, but have a huge impact in a post-COVID environment. And we're going to explore that. And the second point I want to consider is that people think healthcare is a cost to a government, a cost to an individual. But in actual fact, healthcare could and should be seen as an investment. And I think that by changing that mindset, I think we have opportunities to radically move things forward, democratize healthcare, and take things forward. So I'm going to pick on each of these individuals to comment on some of that. I'm going to start with, I'd like to go to Saba. And Saba, one of the things that influenced me most in terms of learning about your company is that you have built a company based on academic rigor. You come from a scientific background. You are an analyst by nature. So certainly in my context, you take things very seriously. You've built a business looking around or looking at and supporting women's health questions and challenges. Give me some insights in terms of my points and in a little bit background to you and your company, please.
Thank you, Alan. Hello, everyone. It's a pleasure to be here. I thank the judges for selecting me as a winner this year. So as Alan said, I mean, I come from a scientific background, and I've essentially used a lot of my background to define the direction of Nabta Health. Nabta Health, in short, is a digitally enabled company that aims to support the improvement of healthcare access, equity, personalization for women from the Middle East and North Africa. And the way that I have decided to co-found the company with my co-founders is to use evidence in order to improve on those healthcare pathways. And the reason why this is important, particularly in healthcare, is because, again, we're moving away from traditional into a digital healthcare model, whether it be in the form of e-consultations, telehealth, home-based tests, applications that cover an array of healthcare options. And what we do is really try and define where there are opportunities to combine various digital parameters in order to make healthcare more accessible and reachable to women. And in the background of all of this is allowing that to be localized to the local community in the local language, available in the culture that we're dealing with, but also informative by provision of content that allows women to be more proactive about their health.
Just to give me some benchmarks, I mean, how many people do you touch? I mean, you've been around for how long, and how many people do you connect with in the community and the program you've set up?
Okay, so in combination, we reach out to women from the Middle East and North Africa, not exclusively, obviously, because it's digital. Anyone in the world can access our health parameters and all of the applications and social media that we have. It's available both in English and Arabic and parallel, so it's accessible to both languages. The Middle East and North Africa, as a bulk of geography, holds over 500 million people.
Saba, I'm going to cut you off, and I apologize for being rude, but I want to move it on. My real question is, how many people have you connected with through your platform over the last whatever period of time?
In combination, I would say over 10 million women worldwide.
Okay, thank you. Can I go next to Sujay? And I would like to point out it's his birthday, so I'm going to be particularly gentle with him. So happy birthday, Sujay, on behalf of everyone in the meaningful business community. But Sujay, you also are a very interesting young man, and you also have driven significant impact, and you've also built that impact on the basis of data. And again, I'd like you to tell everyone a little bit about your company and your work. But what amazed me when I read some of the research behind it is that in India, where you have predominantly most of your operations, the relationship between patients and doctors are 6,000 patients to one doctor. That's a big problem. But I know you've had a major engagement. I know you've had a number of, millions or million plus engagements. Please share with us a little bit about your company and what you do.
Thanks. Thank you, Meaningful Business 100, for the selection. And thanks, Alan, for this question. So, iKure is a population health management company that provides affordable and accessible primary healthcare through a combination of frontline health workers who go to the last mile through our remote clinics and at hub clinics. And we are able to provide a combination of primary healthcare services ranging from mother and child care, GPs, telemedicine, blood tests, medicines, and all the associated primary healthcare services. So till date, iKure has treated more than 1.1 million underserved patients, and we are serving close to 10.2 million population across 7 states in India. And as we speak, we have been able to provide a combination of integrations, digital technologies. So we'll speak in due course. So thanks, Alan, for that.
Well, you may not thank me with my next question. Why have you been able to do that? And perhaps the government or the Department of Health in India is perhaps not as innovative as you. Give me some context here. I mean, what you describe is nothing less than incredible. The impact you're having on the community you touch is literally remarkable. So why have you been able to innovate and the government can't innovate? Or maybe the government is innovating. Tell me, just give our audience some context here, please.
A couple of contexts. So I, being a techie, most of the, in India, what has happened is India has always looked upon and have worked in IBM Oracle as a solution architect. Most of the adoption has been top down, meaning that whatever solutions which are available in US, Europe, or other developed nations, we have tried to adopt that within Indian context. But India and many developing countries across the world are very different. What we have done is I have actually spent a lot of time in the villages, in the rural areas, and maybe a lot of people has actually made a very critical comment that this guy may have gone mad. He has left a very well-positioned job and he is kind of running around in the villages. But what we have seen is that we have understood the problems on the ground. So what are the problems on the ground? The problems on the ground are the internet availability, and I'm speaking of the era of 2010 to 2015. Internet availability was not there beyond tier 1 and the metro cities. That is number one. The people who are using the solutions were extremely naive. They were not tech savvy. And the problems, for example, for most of the techies, when they design the solutions under lab conditions. But we have seen that when we were providing them the solution, the simple gestures, the swipes, that was not working on the ground. The problems of heat, sweat, dust, the UI was hanging. Again, these problems, unless and until you are going on the ground, you will not be able to, solve these problems. And on top of that, there are problems of social, cultural, behavioral challenges, ecos, and all those integrated. So,
but again,
unless and until
I'm going to interrupt you, which again I apologize for. But what's really interesting is that the vision that you took on was a vision built on data, and I think you took it on at a time when data was perhaps not as well understood or comprehended the way it is today, because any business that wants to take on the challenge you're taking has to be data centric. But before you comment on that, and you mentioned the word crazy, so that allows me to go to Howard next. And again, one of the interesting things about my friend Howard is that I'm not going to call you crazy, although eccentric probably is a nicer way of putting it. But, for personal reasons, you took on a challenge. For personal reasons, you decided to take something which was an insurmountable hurdle. And the word perseverance comes to mind in terms of taking on something that most people would probably advise you it's not the smartest thing to do at your age or particular point in your career. But again, what you've built is truly remarkable and has significant impact on numbers. And Howard, share a little bit about what that actually means in your world.
Thank you, and thank all the MB100 winners. I'm honored to walk on the same planet as all of you at the same time. So we started really with, I went as a Canadian volunteer to rural Africa to start a social business for women, because as we all know, men are pretty useless. and women will take care of the health and education of their children. So basically started listening to the hopes and dreams of 10 women who were deaf in rural Botswana in terms of what their problems were, what their life was like. And basically wrote the first business plan based on their hopes and dreams. I found out there was over 600 million people with a hearing loss, yet only 3% of them could afford a hearing aid. The other problem was a hearing aid battery. They couldn't, often they were given a free hearing aid from a charity, but they couldn't find a battery or afford a battery. So they said, hey, let's design a company that makes a rechargeable hearing aid using the solar energy. Let's make it low cost, because hearing aids today start from 1,000 British pounds to 20,000 pounds. So we basically solved those first two problems. The other two problems are lack of professionals in developing countries. There's only one audiologist for every 2 to 6 million people. And that's why only 3% of the world who needs hearing health can afford it or get it. So we designed this new program. Yep.
And how can I assume that, lots of national organizations and charities were running after you and wanting to throw lots of money at you and help you and support you in lots of different ways? Or did you have to battle against that?
The way we battled against what was telling the story from the perspective of these women who were deaf in rural Botswana. I made them say no to them and not to an old white guy living in Africa. And storytelling is a very powerful way to raise money. So that's how we attacked it. And I've started a variety of social businesses, and always from the perspective of the stakeholder and telling their story, what their hopes and dreams are, and again, turning it into a sustainable business.
Just to give us some context, today you are how many years into this project, and how many people's lives have you managed to impact?
So we started in 2002. We've helped over 100,000 people get a low-cost hearing aid, which has enabled them, a lot of cases for a child, if they can get a hearing aid, they can develop speech and go to a public school and get an education. And only through education to break the cycle of poverty. So now we've helped, but 100,000 kids, but that's not enough. And with there's about 180 million children. So we developed this new program using a cell phone.
But you've also,
with a cell phone, we'll do a hearing test, and the cell phone becomes a hearing aid.
But you've
so
also
now affordable and accessible for everybody. Sorry.
You've also broken down barriers using solar technology in order to achieve those objectives. So that's another.
And again, that idea came from these workers who are deaf. They said, hey, we live in Botswana. There's 360 days of sun. Let's use the sun to charge a hearing aid. One of my skills is I come from a place of stupidity, unlike the other members of the team who are intelligent. So I've learned to listen and just really put their hopes and dreams into a business plan. I think most entrepreneurs in the group are stupid and stubborn. And to be successful, you have to be stupid and stubborn.
I'm not sure stupid qualifies. I think stubborn probably ranks quite high on the list. But can I move on to Temie? Temie, can you hear me? Because I can't see you on the screen. Can you hear me?
Yes, I can.
Excellent, thank you. So this young lady is also nothing less than extraordinary, and she's also very shy, so she won't tell you something that I'm going to share with you. But I think it's very interesting, and it's a subject worth exploring, is that in our conversation when we chatted the other day, I learned that she gained her education by traveling to the West and by learning about our flaws and our capabilities and stuff, and then decided that she wanted to take that experience, that knowledge, and take it back to Lagos, take it back to Nigeria, and to build a organization which is really dealing with a very sensitive problem and dealing with something which in logistics terms is extremely challenging. Now I've set you up, or do you need me to tell everyone what you do, or do you want? No, you tell people what you do.
Fantastic. That was fantastic. Thank you so much. So found a problem when I was earlier in my life, postpartum hemorrhage. I found out that it was the highest killer of women in childbirth. I also found out that if you moved blood to the hospital where that woman is delivering, that you can save 8 out of 10 women would die of postpartum hemorrhage.
Sorry, say that again. Just say that 8 out of 10 women.
8 out of 10 women would die from bleeding to death during childbirth or immediately after childbirth. Can be saved if blood simply was in the hospital with them. And this was a problem that was very large. Everybody knew about the problem. It was sort of like one of those problems that, people have learned to live with. I was very young. I say had the hubris that young people have. And I couldn't, ignore that problem. I didn't think it wasn't comfortable for me for this issue to be present and to continue to be reality for thousands of women across the world, in Africa, in, of course, Nigeria, where I was born, in all over the continent of Africa, all over the world, all over countries that are still struggling to build infrastructure. So I thought, well, I'm gonna try to solve it.
Okay, but again, I think you're underselling yourself, because getting blood to hospitals in a time span which is critical, and being able to deliver a level of quality control and compliance is no small feat, that companies like DHL or some of the major organizations would actually be very challenged with. So how did you solve that problem when other people didn't even want to take it on?
Absolutely. I think, we call our system on demand. So when we get an order, we usually have about 40 minutes to get the blood to the hospital very quickly. So, creativity, we solve it by being creative and by being innovative, by the willingness to build technology that is local and localized, by our willingness to use tools that are already present. So I wasn't interested in buying large trucks. I looked at what was available on the market. It was motorcycles. That was how people got around Lagos really quickly. And then I thought, I sort of added, let's put this blood in the right coaching system, in the coaching system that would sort of like rival what you have in the West. But rather than put it in a truck that, that the West uses to just deliver critical supplies, why don't we put it in what, the local economy uses, which is motorcycles? And that's how we started. It was really very simple. It was a very simple model, but it was a model that worked because it was very localized. It was very innovative. And we built a business model around it so that it's sustainable.
Okay, so thank each of you for giving some insights. Now I'm going to make you all feel a bit more uncomfortable, because one of the things that's really important here, and one of the things that you've all achieved and you need to maintain and sustain, is built on three components, I think, which are key. And I'd like to spend a little time discussing it. The three components are: one is compliance. So each of you are challenged with compliance requirements within the market sectors that you work. So compliance is one key component. Something which is often misunderstood by many young companies is localization. And localization is understanding local cultures, local disciplines, local methodologies, but actually having a deep insight in what local is. You cannot just come from London to Lagos, for example, and expect to be successful any more than going to any other city in the world. And I think it's something that young companies need to understand, that a localization strategy is key. And then the third one, which is even more abstract, is that you've all built businesses built on the word trust. So I'm going to allow each of you to take on that challenge. I want to talk about compliance. I want to talk about localization. I want to talk about trust. And I'm going to go first to Howard.
Okay. So actually, compliance was one of the problems in my industry. You have, in most countries, only an ideologist that can fit a hearing aid. What happens if you don't have an ideologist? So we had to develop a new distribution strategy, taking out the professional, making the products accessible and language neutral, that anybody can give their own hearing test. In terms of localization, again, we started in rural Botswana, listening to the people in rural Africa. We replicated it in Brazil, and we modified the program, listening to the people who were deaf in Brazil and people with hearing loss. And then we scaled to China and India. Again, each time adding some new knowledge to the whole program, and then sharing that knowledge amongst all the solar operations around the world, which are all independently owned and operated. They own all of it. And in terms of trust, it came from the people who we want to help have that problem. They know the problem better than anybody else. So people trust the people who invented the product, which are basically women who are deaf.
And Saba, going to you a little bit, where do these challenges around compliance, localization, and trust sit with you and the community that you serve?
I think the compliance issue is actually quite interesting. Because we combine different digital parameters and because it's digital technologies in healthcare, the regulation around those is not quite as caught up with where traditional healthcare is. So essentially it's on me to assess every single technology that we want to integrate, ensure number one, that it's clinically valid, that it's personalized to and designed for the individual. And at the same time, we are going into a region, the Middle East and North Africa, that has very different compliance regulations. So we have to be very, very careful and very sensitive, but essentially try and do as best as we can to adhere to international standards, GDPR, HIPAA compliance that the US and the UK adapt. Some regions are adapting similar pathways and mechanisms. And it's very new, Alan. I think, you know, we're seeing this whole thing about compliance with regards to digital technologies.
But also, I think that in your region, I think that culture needs to be considered very carefully.
Absolutely, which goes into the culture and the trust. So the way that we've built the company and the way that we've designed our product is very much localized, as in it speaks the language, it's culturally relevant, it's private, which a lot of women want to have, that privacy, that autonomy and anonymity, specifically around areas that are sensitive, such as cancer, sexually transmitted diseases. And then the trust comes as a part of that whole pathway. You know, you speak to women, you ensure that they speak their language, and it's something that will continue to be built. It's not something that grows overnight.
Okay, and if I refer the question to Sujay, you touched on that a little bit earlier in terms of the data piece. You know, you're dealing with highly sensitive information. You have to build that trust coefficient, not just for the patients, but also for the organizations that you support. So again, you know, where does localization, compliance, and trust sit with your work and your people?
Yeah, so on 25th of March, Government of India allowed the telemedicine to happen officially. And with that, you know, there have been telemedicine happening, but, you know, the doctors have been restricting with just OCT drugs, over-the-counter drugs, and not the actual diagnosis which was happening. We launched something called the aided telemedicine. And with that aided telemedicine, we have the frontline health workers who are carrying smartphone loaded with our application and medic bags. So they are able to go to the patient's doorstep, capture all the data, initiate the call between patient and the doctors. So that actually has helped a lot of you know, the trust factor within the community, because earlier what was happening is that patient was seeing the doctor on the television screen. They were not knowing whether that's actually a doctor or not. But now with the frontline health worker who already know, because they are from that community, so there is already a trust factor which is built in, and we are also complying with the Government of India regulations. So it's a combination of trust and the localization which we have been able to build in. To give some other examples of the trust, what we always do is we work with the ground partners, like the various local NGOs. So they could be working on ed tech, financial inclusion, agriculture, and they have been there for many years. So they are already providing the other kind of services. And when iKure is being introduced within the community, they're saying, hey, this is we are able to work with them and work on the trust to provide our solution.
Well, I want you to hold that thought for a second, because my last question is to do with that question specifically. So can I come back to you with that question in a moment? But Temie, just going to your area, and I don't want to be challenging more than I normally am, but I think one of the issues is the quality control of what you're dealing with. Is, you know, that there is no second chance. It's got to be the right thing, the right place, the right time. And the pressure, I mean, again, I can't begin to imagine the pressure, you know, I mean, again, you look as though you have very sleepful nights, but I can imagine that sometimes in your project, there's probably less sleep than you might wish for.
You know, you're absolutely right. We run this distribution system that is 24 hours, 7 days a week. We've been 24 hours since the day we launched. We never shut down. We have to do it on demand. We have to do it quickly, and there's a life in the balance. So it isn't, you know, it's high stress, you know, it's an incredibly high stress environment, our life bank. But I think we've been able to rise to the occasion by building systems that hold. No matter how much you stress test it, it holds. Recently, you would have heard about a major emergency, a major riot that happened in Lagos, and that was a stress test. COVID-19 shutdown was a stress test on this system we have built. And one of the greatest pleasure of my life is to see that the system we built held, and that's really incredible. So how do we do this?
I'm going to interrupt you again because we're running tight on time, but both you and Sujay have given me the opening that I wanted for my last question, and I make no apology for this one either. But if you just accept, and I'm sure the audience now has some insights purely on the impact coefficient of what you guys do, then you deserve a big pat on the back, if not a lot more for that. But I want to challenge you is that I wonder whether you need to be less selfish. I wonder you need to look at yourself as a solution. I wonder whether collaboration, where what you've built, the networks you've built, the people you've built it with, the resources you've got around you, could be collaborative and resources for other companies to piggyback off of your hard work and due diligence and actually build, I'm going to call it solutions for your environments rather than specific technology capability. And Sujay, I'll let you go first because you started to go down that direction, and I'm keen to understand your vision of where to take the democratization of healthcare to the next level.
Yeah, so for example, we work with the NGOs on the ground who are already having the localization and understanding of the community, and when iKure is able to come in. Similarly, we would like to give the example of Nagaland. So during the COVID time, USAID funded this project and iKure was brought in as one of the preferred partners to roll out the telehealth opportunity for the entire state of Nagaland, which is one of the small hilly state in the northeast part of India, bordering Myanmar. This is an extremely difficult terrain, and we were able to utilize the government machinery, government infrastructure to provide a solution. So here, iKure has been providing the technology know-how, working with the state government, working with the frontline health workers to fight the COVID emergency response. And within 25 days of time, we have rolled our solution across 85 government centers. You can imagine how hard it has been. And without the government support, without the state machinery support, without the local support, it would not have been possible. And by end of this month, we will be rolling out across 194 centers, means the entire state of Nagaland. So it's very, very important that iKure is absolutely right. We don't believe in that only iKure has to do everything. We always believe in collaborative partnership. Like our solution has been invited to do work in MENA region, Middle East, North Africa region for the 7 Red Sea countries, wherein we would like to provide our technology know-how and work with the local partners to provide our solution.
So can I suggest respectfully, you need a new PR director to actually tell people a little bit about what your vision is, but we can probably discuss that offline. Temie, I'm going to chuck the same problem at you. What you've done is truly remarkable. The infrastructure you've built, the on-time resources, delivery capability. But how would you feel about me dumping other companies on your shoulders and you supporting other people achieve the logistical challenges that you've been able to overcome? Is that something you'd be interested in or something you would be reluctant to take on?
No, absolutely. Very interested in it. I think one of the ways that I think about what we've built is it's a platform. We know that there's so many other things that can be built on the platform, on this distribution system we've built. For example, when COVID-19 happened, we moved from blood to medical oxygen to COVID-19 samples, etc. So it's a platform that can be built, that we can build different systems, different value chains on top. For example, there's a vaccine out now for COVID-19. We're trying to see, we don't necessarily want to be, we're not a manufacturer of vaccines. We have nothing to do with that system, but it is a system, a last mile delivery platform that's been built that other systems, other platforms for vaccine delivery, for example, can be built on top. So definitely happy about it and open to it. Of course, it's really important to be the first one to start and to build that foundation.
You may not thank me, but just keep a look on your email inbox and see what happens over the next few days.
No problem. We're ready.
Howard, I'm conscious of time and conscious there may be some questions coming from the audience, but Howard, I'm going to come to you with the same sort of philosophy, is that given your relentless pursuit of driving this change and this disruption, if I can call it. I mean, a lot of people can learn from your experience. And how do you feel about sharing your lessons learned with a community on a wider basis? Because I know that's something that Tom and the team of Meaningful Business want to do at scale. How do you feel about that?
Well, that's always been critical to our success. That we realize we can't be alone to succeed. We don't have the knowledge, say through microfinance or micro entrepreneurs in developing countries. I'm fortunate, like Sujay knows, we're part of the Ashoka network. So we can call on each other to help each other. We're part of the Duke Health Innovation Program. So our success only comes through networking, knowing our weaknesses, and then finding help outside to strengthen that weakness.
Okay, and Saba, I mean, again, you know, we discussed this a little bit when we chatted last week, but I think that as much as you have a focus on a particular region at this point in time, and quite rightly so, as a woman tech leader, as someone driving well-being and good health protocols for women, I mean, surely you must have aspirations of being a global entity rather than a regional entity.
Absolutely, Alan. I mean, we've touched upon this, and I echo every single element of what my panelists have said. I mean, essentially, we are a platform like Temie's. What we do is we very much are collaborative. I think we touched on the fact that, you know, coming from a scientific background, an academic scientific background, scientists are taught not to share because they're worried that their work is going to be taken by others. And essentially the ethos that I've come within Nabta is that there are people that are doing fantastic work, and why not combine everyone else's work and bring in the evidence base to combine their solutions in order for us to become really the global leader for women's health. And that's the aspiration.
But I also think, just as a personal anecdote, and this is applicable to a number of the companies that I work with quite closely, is that as much as you need to focus your time, energy, investment, whatever it is, grants, whatever the scenarios are, on your core competencies and your core requirements, I personally think that being part of this meaningful business environment and community and being able to share your experience with others is a critical path. Absolutely. Not just in terms of just thought leadership and insights, but also in terms of resources. So, you know, these things are not, I mean, I think it's interesting. I mean, if you look into the world of technology right this very moment and the impact that COVID's had in investment, you will see there's a lot of mergers and acquisitions going on. I'm not suggesting mergers and acquisitions for you guys, but if you think about the principles of it, companies are acquiring companies or partnering with companies to achieve a deeper relationship or a deeper engagement than they would do on their own. It may well be that Slack is going to become part of Salesforce. Salesforce is a CRM platform dealing with the management of individuals, customer relation management. You put Slack into Salesforce and both companies are impacted significantly. The point I'm trying to make is each of you has significant impact. Each of you has significant value. Each of you has lessons learned. And the more that is shared and the more that you have the time and ability to collaborate with others, then the piggyback effect and the opportunities to scale grow incrementally for everybody. That's maybe a naive philosophy. Maybe I'm more stupid than I look, or maybe I am as stupid as I look, but I do believe that is very much part of the world we're entering into rather than the world we've just come from. Anybody want to add to that? I'm looking for questions. I'm not sure. Do we have some questions from the audience? So Herman Coe was very kind to address. Is it a question? Can Herman join the conversation if he wants to? I mean, just before Herman may join, there's two things that come out of this, or comments that were made in the chat. One is the sharing of data. So I think that is a key component, because what you look at in data, what others look at in data may not be the same thing. So sharing data, knowledge, expertise is one piece of it. The other thing that I'm pleased we've been able to put across, that was the comment that Herman made, is resilience. I think resilience is key. the challenges in front of you, insurmountable hurdles, breaking down barriers, and building sustainability is a key outcome from this conversation. So certainly that's one area. Let me just read and see. I think that's the genesis of where I'm getting from the chat. I mean, I know that Tom can connect with me through WhatsApp if he wants to send me a message, but I'm just going to continue discussion for the last 5 minutes that we're here. So I've been provoking you guys for the last 35, 40 minutes, okay? And you're still smiling, so I don't know if I've done a good job or a bad job. But if you've got a call out to this audience, what would you like to see? How can people help you? Howard, I'm going to go to you first. What would you like to see? What sort of response from the community that we're touching on? How can people help you fulfill your aspirations?
Sure, there's probably 2-3 ways. One is obviously for all of us is funding, but it's not just money. It's a funder who can add value to what we're trying to do. There's many shortcomings of our present knowledge. It may be through distribution, may be through technology. Through one of funding organization who can add value. The second thing is I realize I'm not the one to run this next generation of the company. I'm going to look for a CEO to replace me very soon. Digital health is a whole new business. It's a whole new marketing mix. There's mobile money. There's different ways of getting paid around the world. I don't know how that works. So I need people to take over to do that. And I need hopefully a funding agency who can add value to our proposition of getting more hearing health to more people around the world.
Okay, so anyone out there who wants to jump on Howard's shoulders, who's open for that?
Take over my job, fire me and take over. Great.
Well, no, you do still have value. I want to point out to you that you don't get away that easy. That it doesn't work like that.
Okay.
Saba, I'm going to go to you next. I mean, in terms of what are your needs? What are your requirements? How can we as a group of people, community, help and support you in your work?
I think the support has been absolutely amazing, Alan. You can never get enough support. Obviously, I think everyone on the panel and everyone in our space can always do with a little bit of funding, but also equal to what Howard has said and echoing what he said, it's important to have aligned funders and individuals who believe in your mission. Yes, we are a social enterprise, but we would like to make money in order to make more good. And I invite anyone who believes in our mission and what we do, whether it be from sort of the improvement of healthcare in general, and healthcare doesn't have to be physical, it can be mental as well, which is important to highlight, to come on board, have an open discussion. We have an open door policy. As long as you go through my very rigorous data-driven, evidence-based checkbox, then you're more than welcome to come through the door.
Thank you for that. And I'm going to go to Temie next. Temie, how can we help you?
We have big dreams. We want to expand to all the places where this problem exists. Expansion requires capital, it requires the right team, it requires localization, so partnering with local team members, local people. So we're looking for all of those things. We're looking for capital, either it's grant or equity. We're looking for the right team. If you're on the call and you have a ton of experience in distribution in healthcare, and you want to partner with LifeBank by joining our team, I'm calling. We have open, like Saba mentioned, we have an open door policy. I'm always hiring. And if you are a local entrepreneur or local company, local business, local organization, all over the world where this problem still exists, please get in touch with us. We want to build a big business that solves this problem at scale globally.
Okay.
So we're always looking for.
To give last words to Sujay because it's his birthday. He deserves the last word. So Sujay, on your birthday, apart from a birthday cake, what would you like?
Yeah, I think so. At iKure, our dream is to reach to treat 10 million patients in the next 4 years by building a chain of 190 primary healthcare clinics and building on technology. So iKure is a for-profit company. We have been profitable for the last 3 years. We have got investments from US, India, Singapore, and Japan. And recently we got the funding from Mr. Ratan Tata. As you know, that he is one of the industrialist out of India. And in his words, he mentioned that this is the true need of the country. So coming and getting such inspiration from someone like him has been really great for us. And now we are looking for the next round of investment. We'll be happy to share our deck. Apart from the investment, iKure has been working on a lot of technology integrations, like the one with Microsoft Research Labs and Data Privacy Network. Your compliance definitely addresses that, because India is coming up with NDHM, National Digital Health Mission.
We are running out of time and I need to get back to Tom.
Yeah.
But before I do that, can all donations be sent directly to me? And then I will decide how to distribute them to my friends and colleagues.
Absolutely. We trust you.
I'm not sure that I was mentioning trust. I'm not saying you should trust me, but anyway, my point is, thank each of you so much for your contributions, your frankness, your openness. It's been a fun conversation. I hope the audience have enjoyed it. Thank you very much indeed.